KK Cheng is a professor of public health and primary care at the University of Birmingham in the UK and joins us now. Great to have you on the show. So help us understand, should we or should we not be wearing masks outside? Because it seems the debate is shifting right now.
Before I talk about masks, I think it's always important to stress that hand hygiene and social distancing is a really key to our control of this epidemic. So don't go out, stay home if you can. So by doing so, you will save your hospitals, you will save lives. So talking about masks, I think most people wear masks thinking that it would protect themselves. A much better public health reason for doing so is actually to control the source of infection and to protect others from droplets coming out of our own airways. So in a pandemic, I wear a mask to protect you, you wear a mask to protect me. And if everyone does that, everyone is protected, but only if enough people do it.
So your advice, just to be clear for everybody, is to wear a mask?
When you go out and when you do so, the question arises about what kind of mask I should wear. For this purpose, cloth masks are perfectly adequate. The high specs mask must be reserved for our healthcare workers who work in ICUs on hospital wards. So don't go and grab these high specs masks.
Okay, so cloth masks. And we heard President Trump say you should wear scarves as masks. What's your advice and comment on that?
Mechanistically, anything that block things coming out of one's airways would work a little bit. Otherwise, why on earth do we ask people to sort of cover the mouth when they cough, or actually using your flex elbow? If a mask doesn't work like that, there's little point in doing those either. So I think mechanistically, there's very strong evidence for doing so. So
a scarf, again, just to be clear, could work. If you don't have a mask, wear a scarf, something that would cover your mouth when you're going out.
If everyone wears a scarf, it will reduce the source of infection tremendously in the population. It's just like, if you get an analogy, it's like driving a car. If you drive carefully, you not only protect yourself, you actually protect against others. And if everyone drives carefully, the whole population is protected. The roads would be a lot safer.
And so why have we had advice that was different to this from the WHO, for example, for so long?
I think previously the focus, as I said, people thought that, these recommendations are to protect the wearers. If we shift that away completely from it and to think about others, then actually these are lower spec masks, including even a scarf, would work. And because these authorities worry about shortage of masks, if they advise people to go and get masks, then where are we going to find them?
Absolutely. And just before I leave you, I'm working. I have many colleagues here working, like many newsrooms around the world. And so you would advise us to keep our social distancing and wear cloth masks. That's your advice for people who are still working, who are not obviously key workers, medical workers.
Absolutely. For example, if you travel in crowded underground train, if everyone wears a mask, everyone will be protected. And we need these true heroes of society to stay healthy.
Beautifully put. Really appreciate your time. KK Cheng speaking to us from the University of Birmingham in the UK. Thank you.